Simpson-Crumpley. I am representing the South Carolina Office of Rural Health, and I am a PCMH, Patient-Centered Medical Home Consultant and Quality Improvement Coach. And this webinar is being brought to you by, sorry, I'm having some technical difficulties, by the South Carolina Office of Rural Health, as well as the Best Chance Network through the SC Department of Health and Environmental Control. And so our guest speaker today will be Maxine Wright. She is a BCN coordinator for the James Clyburn Center for Primary Care, Rural Health Services Incorporated, and they are located in Aiken, South Carolina. And so the whole why for this webinar today is we developed a strategic partnership with the Best Chance Network. Stephanie Hinton and Trinesha Jones, the administrators for these programs, are joining us today. And we want to be strategic about increasing the level of screenings for breast and cervical cancer in rural communities. As you all may be aware, rural communities are the hardest hit for breast and cervical cancer death rates. I'll be referencing that today. And with that, I thank you all for taking time out of your lunch to learn more about getting women into screening and for the care that they so desperately need, because at the end of the day, Best Chance Network and programs like it save lives. So with that, we'll get started. By the end of this webinar today, our hopes for our attendees today is that you will be educated about the Best Chance Network program, learn about the importance of getting women screened in rural communities and into treatment if need be. Learn the day-to-day operations strategies from a rural BCN program coordinator that's doing this work every day at 3 sites. And by the end of this webinar, for those of you that actually have Best Chance Network programs, and for you to leave with 2 practical tools to get started within the next 24 to 48 hours. And for those of you that don't have a BCN program, we want you to get signed up, and we will be giving you information at the end of the webinar to do so. So just a little bit of history about the Best Chance Network program. Since 1991, the Best Chance Network serves as South Carolina's state program for the National Breast and Cervical Cancer Early Detection Program. It provides comprehensive screening and diagnostic services for low-income, uninsured, and underinsured women across the state. It is commonly referred to by locals in the community as the free mammogram program, but as you'll learn, it is a comprehensive program that provides the services that you see here. So not only mammograms, clinical breast exams, pap tests, pelvic examinations, HPV testing, diagnostic testing just in case abnormal test results come back, and referrals to treatment if indeed an abnormality is found. So to really bring to bear the seriousness of breast cancer in rural communities, this is from County Health Rankings. This is a report that comes out every year, and it's one of the best collections of data on public health trends by county, and there is one for every state across the United States. So in South Carolina, you can see that the highest rates, breast cancer death rates from 2009 to 2013, are happening right in rural communities, Williamsburg being number 1, Chester County being number 2. And you can see the others that are adversely impacted. So our partnership is key. The folks on this phone, as well as the Office of Rural Health and the Best Chance Network program, in terms of getting hands-on support for you to make sure your practices are ready to get women in the door to bring this rate down. Another representation by map of where breast cancer deaths are happening. As you can see, the PD is the hardest hit region of the state for breast cancer deaths, and that's all races. However, if you are not aware, black women are more likely to die from breast cancer, and they're more likely to be diagnosed with an aggressive stage of breast cancer. So we are talking about real health disparities here, and we have the power to change that. Second behind the PD is communities in the upstate going on down to the Savannah River, Georgia, South Carolina border counties. They are hit as well with high rates of breast cancer. When we look at cervical cancer, it is a similar trend, with the PD being hardest hit from the upper parts of the PD region down to the southern parts, that real work has to be done to make sure practices have what they need to get women screened and hopefully detect these cancers early so we can save lives. Why should this matter to us? I know all of us have been touched by breast cancer or some type of cancer in our families and our loved ones, and we know that when you get routine screening and detect breast cancer and cervical cancer early, you can save lives. And I'll be talking about signs of heart disease too. I'll be referencing another wonderful program that can be a complement to the BCN program later in this presentation. So we want to save lives, but let's keep it real, everyone. Our rural practices need to make money to keep our doors open. So when Best Chance Network Best Chance Network program services can bring money into your practice, and not only that, not just for the initial visit, but follow-up visits for that patient as well. So looking at the potential to create, number one, a medical home for the patient, but number two, we are hearing about MACRA. We are hearing about myths and the importance of demonstrating your capacity to produce results in terms of quality improvement measures. Well, guess what? Best Chance Network, if you work that program, it will provide the foundation for you to be successful in meeting your targets for PCMH, HEDIS, as well as PQRS. Rural counties, I've just referenced this in the previous slide, have the highest rates of breast and cervical cancer related deaths. And as I've stated before, the PD region is the hardest hit. So as we were preparing for this presentation today and laying the foundation for our partnership with the Best Chance Network, me and my team member, LaShonda Petaway Brown, who is a veteran quality improvement coach that works for our office, we undertook the task of interviewing representatives from 30 rural practices across the state of South Carolina about their experiences implementing the BCN program. And here are the major three themes that evolved from those interviews. Number one, there must be a person whose primary responsibility in the practice is implementing and overseeing the BCN program. Now, it is not their sole responsibility, which brings me to the next point. It must be a team-based care approach for the program to be successful. So while you may have your medical assistant, for example, that's responsible for managing the BCN program, we need frontline staff reminding folks when they come in for appointments that they're due for their breast cancer screening. We need other team members to make reminder calls. We need clinicians fully aware of the information that needs to be taken in order to be paid for BCN services. So as you can see, it is a team approach. There is a quarterback and there are supporting players in this this reality of trying to save lives and try to create that dynamic. Finally, feedback that we receive from practice managers is that more outreach needs to be done in rural communities. Unfortunately, there are breast cancer screening services available through Best Chance Network. However, folks don't know about it. So one practice manager literally passes information to her pastor, and he references Best Chance Network services through her practice at Sunday services. During the sermon, she uses her own Facebook page to remind folks that services are available, but using local radio, newspaper, and billboards in rural communities to heighten awareness about the availability for services. So this brings me to the most exciting part of the presentation, stories from the field. I don't know about you, but I learned the best through the stories and people sharing their real life experience with programs like this. So I'd like to introduce you to a Jewel who has graciously offered her expertise today. Let me introduce you to Miss Maxine Wright. She is the Best Chance Network coordinator and laboratory manager for James Clyburn Center for Primary Care, Rural Health Services Incorporated. This is a part of a family of federally qualified health center sites in the Aiken, South Carolina area. She is a native of Bath, South Carolina, so this is a rural girl through and through. Particularly went to Wagner High School. She is a trained phlebotomist and was certified through Aiken Technical College. She currently resides in Aiken with her husband and her daughter, and she has 4 years of experience managing BCN programs at 3 sites and managing their labs at 3 sites. So when we talk about the capacity to be able to oversee programs, she's going to share that experience with you today. So Andrew, is Maxine live?
Yes, I am.
Yeah.
Okay, Maxine, you're up.
Good afternoon, everybody. As Tiffany was just stating, different things about the BCN network, I can say it's a very good program that the state of South Carolina is doing. But first, I want to enlighten you on when I first took this job over, it wasn't a piece of cake. It was, well, really, it's a job that you really have to put yourself into. And as I put myself into this job and just thinking back as what if this, what if it was me? And then all of a sudden you just get to stop thinking about self and then you start thinking about others. So as I grew into this job and start learning the aspect of the job, in and out of the job, I saw where it became rewarding. But to give credit to, first, in the beginning, our South Carolina Regional Service Coordinator is Caroline Keith. If it wasn't for her knowledge and giving me the aspect of contacting her whenever I needed her for any and everything, I wouldn't be where I am right now with this job, or in this job, as I put it. So I don't know how many of you are already doing the BCN or how many of you are thinking about doing it, but there are steps and protocol in doing this job. So I guess I'm going to start from the beginning. The state allow us X amount of numbers. They give us X amount of numbers that we can see per year. And as time goes by, if we run out of those numbers, they give us more numbers. But the steps in doing this job is getting the patient in and getting them signed up. First of all, before any patient can be seen, we must obtain the pre-authorization number from the state. And then the form is to be filled out, and we schedule all the patients and give them a date and put them on the schedule. And then after that, well, let me back up. I'm a little nervous with this thing. Let me back up and let me get it right. Okay, first we have to obtain the pre-authorization numbers. Okay, those are the numbers that we get from the state. And then upon receiving those numbers, then we call our patient and we schedule our patient to come in. Or if a patient have heard of us, they will call us. Or they have read a flyer somewhere that we have put out, or in grocery stores, churches, or other places. And then we go ahead and get that patient in, and we get the patient, get their eligibility, their household, their income, how many is in their household, and their income. And once we get that, that let us know the patient has been cleared to receive the BCN care. Okay, now once we go through all of that, and then we get the patient in to see the provider. Ms. Crumpley, is there any forms that can be shown?
Yes. Andrew, for some reason I can't click to the slide with her form. There we go.
Okay, thank you. Okay, this is the first form I was talking about. This is the beginning stage of BCN. Everything that you see here is the beginning stage of BCN and what it absolutely leads up to, all the way down to the abnormal PAPs and mammograms and whatnot. Okay, Ms. Crumpley, can we go to the next one? No, that's not the next. No, that's not the next one I want.
This one?
No, go down. It's the pre-authorization form that they have to fill out.
Okay, now that we don't have, that's the official DHEC form, correct?
Right. Yes, yes.
Okay. Now, unfortunately, we do not, we put your forms that you created, and that's something that I wanted to share with everyone. The forms that we are highlighting today are ones that Ms. Maxine created to assist her in her job. And so there is an official DHEC form that must be filled out. And so as an addendum to today's presentation, we will send you out a sample form so you can know what type of form she is referencing.
Okay, thank you. And then again, in order to get this job really completed, you have to, it has to be done through a team of people. There's no one person that can really do best chance and do a good job at it, or see a large number of patients. Okay, can you scroll on up? These are forms that I created that helped me into doing my best chance. That really has gotten me to where I am in the Best Chance Network program. This form here, what you see now, is a contact letter I created. And that was because we have a large population of patients in rural areas. And nowadays they have these phones where the minutes run out, or they may sign up with one phone number, or they may change the next week or so and have a new phone number. So this was something I created in order to reach our patients and stay in contact with them. And does it work? Yes, it works. Okay, can we roll on to the next one? Now this form here, what you are looking at now, is a form that I created. And the reason this form was created by me is because of the providers and the MAs. When a patient come in, they have to know what the patient is being seen for and what questions need to be answered on the best chance form. Dealing with best chance, there's a form, the bill and screen, which is called the bill and screening form. And that's the most important form when dealing with best chance. There's information that has to be put on that form. And in order for that to be a success, I created this sheet here, which is questions to give the MAs when they're working up the patient. And I also gave one to the providers. So whenever they look at this form, they know what information is needed for me to process my best chance patient and get that information into best chance. And does it work? Yes, it works very well. Okay, can I have the next one? Okay. This form here is questions that the providers have to answer. I mean, this form here is a must. You can send that form in to Best Chance time after time. If these questions are not answered, you will not get paid. Any form that has been incompleted and not in on time, you will not receive any revenue from that particular form. And this lets the provider know their job on what to do and what is needed. And the main thing is to maintain a relationship with your MAs and the doctors, and above all, the doctors. Once you kind of get them like on your side and get them knowledge of what is needed, it works.
Maxine, to interject, just to ask you a very pointed question, can you walk through what your workflow looks like? Like, what are the other roles of your team members? Because you're primarily responsible for managing the program, but how do you interface with the other team members to serve a patient?
Now, once they learn the job, I don't interface with them, on a day-to-day basis because, once they learn it, where I come in, well, if we get new people, well, that's where I come in. I make them aware of the Best Chance Network program. And I sit down and I talk with them and I carry them through the steps that are needed. And mainly, this is, what I do.
Okay.
And then once they learn, then it's okay.
So there's almost a training component that comes with as new staff are on board. Just to make everyone aware, this is a
Yes.
large federally qualified health center site, and so there are new, particularly clinicians, new clinicians that come on, and Ms. Maxine trains them on the BCN program and uses this form as a complement to the official DHEC form to make sure all the critical pieces of information are needed, but she also manages programs at 3 different sites. And so I'm kind of cheating, but really just want to highlight how Ms. Maxine really interfaces with her staff, and everyone has a role in supporting her getting women seen at these 3 different sites. We have about maybe about 5 more minutes. What are the most critical pieces of advice that you would want to offer someone who is on this call, who may be a BCN provider or thinking about signing up? What are the best pieces of advice that you could give them?
Is to maintain a relationship with the regional service coordinator in their area, form a relationship or training with the MAs and the doctors.
Okay.
And I think that's about it.
And I pose this question at the end of our site visit. If you, what would there be any aspect that would be helpful in implementing the Best Chance Network program? Like, what is currently a challenge for you in your role right now? What would be helpful to you and anyone else that's implementing a rural BCN program?
Well, what really would be helpful in this program now that we have grown and gotten bigger is if Best Chance would allow us more than 30 days to get the forms in. If they will just allow us that, because when you have another job / BCN, it gets very busy and very stressful. If they would maybe move it on up to maybe 60 or 90 days, maybe give us time to get that information in, that would be very helpful.
That is helpful. And another critical piece, let's talk numbers, Ms. Maxine, in terms of, what type of revenue could be brought into a practice? Like for a sample month, how much money has the BCN program generated for your family of 3 sites?
Well, our newest site just started, but I can give you information on 2 sites. Like last year, they allotted us 390 codes, and out of 390 codes, we saw 254 patients last year. And we treated breast and cervical cancer. We treated 31 patients. And the amount of money we generated was almost $30,000. We generated $27,299.
And that's at 2 separate sites, Ms. Maxine?
Well, combined.
Combined, okay. And so I wanted to highlight that in terms of the potential revenue. And Ms. Maxine, if I'm correct, this is not just initial sign-ups, and this is also follow-up visits that this revenue has come from as well.
Of course.
Okay.
This includes the follow-up, the rescreening, treating, abnormals, normals. This is everything.
Wonderful.
Mm-hmm.
Anything else you'd like to communicate to our family of participants before I move on?
Best Chance is more than just getting a patient in and screening her. If she has to be treated That's another thing, and if she has to be referred out, that's another thing. And of course, each time there's a form has to be filled out to support all of this. So best chance is more than just getting a patient in and just screening her and just letting her go. It's more
Yes.
to it. But by all means, it's worth it. You develop friendship with patients, and a lot of times I'll call them, I'll check on the patient, see how she's doing because she, she crosses my mind from time to time, and, I give her a call and just see how they're doing.
Miss Maxine, thank you so much. I know you were nervous today, but I really believe that you shared some nuggets of wisdom with the participants on today's call. So I want to thank you for your participation. Maxine is going to remain on the line. If you have specific questions for her, and as I said, specific BCN questions, we do have the administrators from the program joining us today. So if you click on the raise your hand button, Andrew will be monitoring the chat box, and when we come to the Q&A session, we will take questions in the order received. So to wrap this presentation up in a nice package and get to our Q&A session, really just want to drive home this question, the famous WIIFM question: what's in it for me as a rural practice? As Miss Maxine so eloquently stated, it's increased revenue from initial screening appointments but follow-up visits as well. And I'm sure that many of the patients that came through her center at the point of entry for the BCN program have remained there as a medical home. Second point, it aligns nicely with other quality improvement measures that you must produce as a part of the patient-centered medical home certification process, HEDIS measures, as well as PQRS. This is all as you're building the capacity to produce quality improvement measures, you're also preparing yourself for better reimbursement through MACRA and MIP. So you're being paid as you're building a foundation to be reimbursed by Medicare and Medicaid. Finally, by serving as the point of entry for breast and cervical cancer screenings, you have the opportunity to keep that patient in your medical home to address their holistic needs. This is just a slide that goes into detail in terms of participation in the BCN and the Wise Woman program, which I will reference briefly in this presentation. So many of the aspects of this program qualifies you under Standard 2, Standard 3 for population health management, because you're identifying a population of women to do intentional interventions with, care management and support, coordinating their care under meaningful use. You also receive credit for closing the referral loop. So when you refer out and you bring that patient back in and you're able to provide documentation of such, that helps you qualify for meaningful use as well. HEDIS and MACRA, again, this is just a listing of some of the services that would be provided through the BCN program, but also the Wise Woman program. And this also qualifies you for better negotiation on contracts for performance. And finally, we've talked about enhanced reimbursement, qualifying for that through MACRA and MIPS. So on this journey, we've taken you through the nuts and bolts of the BCN program. So now what? What do we do with this information? So here's our call to action to our webinar participants. Number one, if you are not signed up for the Best Chance Network's program, get signed up. Contact information will be provided at the end of this presentation. And some practice managers talked about this idea of sitting on PA codes. Imagine basically sitting on money, and that's essentially what those PA codes are for your practice. So Get in contact with Ms. Trinesha Jones. I'll provide her information at the end of this presentation. Designate a practice champion and supporting roles for staff and clinicians. And be intentional about creating a team approach, because when you do it for the Best Chance Network, you'll do it time and time again for other quality improvement measures that you are trying to meet in your practice, which overall improves patient care. Ensure that your electronic health record system has a template built in there for screening alerts for patients that come in. Front desk staff can say, hey, did you know you're due for a breast cancer screening? So making sure that your EHR is working for you. And Maxine did not reference this in her presentation, but she also has a manual system for contacting patients due for screenings, but she also receives information from her electronic health record system to help her in her process. Determine the workflow process that works best for you and your organization. So how does the ball start? And the excellent resource is that protocol that Maxine provided, and we will provide sample copies of those forms as a follow-up to this presentation. Next steps, do not be afraid to rip off and duplicate. We've shared sample forms today. Maxine has received approval that you can use those forms and customize them for your practice. Building on Ms. Maxine's presentation, establish and maintain a relationship with your BCN regional coordinators. They will help you in terms of navigating onboarding for the BCN program in your practice. For smaller practices, where I'm talking to those representatives that are in those rural health clinics where you have maybe 4 full-time staff and need extra manpower, this is where student interns would be key in your practice. There are local technical colleges in your area with allied health programs. This would be an ideal opportunity to provide an internship for a new MA. Ms. Maxine is a trained phlebotomist, but anybody in an allied health program that needs an internship, this would provide support for you in terms of calling patients, sending out letters, helping with the nuts and bolts of operationalizing your BCN program. The South Carolina Office of Rural Health has highly qualified quality improvement coaches that will visit your practice and help you implement change strategies to optimize your EHR using patient portals and EHR-generated reminders and standing orders. Just a brief a brief overview of the Wise Woman program. If you are already a Best Chance Network provider, so you must be a Best Chance Network provider to implement the Wise Woman program. This is a program that works to reduce factors for heart disease in low-income women from 40 to 64 years of age. Services include cardiovascular screenings, health coaching, and lifestyle changes with a focus on controlling high blood pressure. I like to refer to BCN and the Wise Woman as the dynamic duo for holistic patient care, because there's a well-documented link between uncontrolled hypertension and obesity and cancer. So we want to address those two at the same time. Another key point, with many of our patients having Obamacare policies, if they have a high deductible of $1,000 or more, they qualify for BCN services. So just because they have an Obamacare policy does not mean that they can't get services through BCN. So again, $1,000 or more of a deductible and they can receive services. These are key contacts. I'll go back to this slide, but I want to, while we have 7 minutes left, open up the floor for a question and answer session. So Maxine is available to answer questions, as well as Stephanie and Trinessa. Andrew, do we have any questions in the queue?
Yeah, I've got a few. Go ahead and touch on the eligibility. I don't know if we went through that before, but like the actual eligibility guidelines. I've got them here if you'd like for me to go through
them. Andrew, please go over that for the group.
So the Best Chance Network program, many of you that are already providers would know this, but it's a certain population that are eligible for this program. And so for patient to qualify for the Best Chance Network, they must live in South Carolina. They must be in the age range of 30 years old to 64 years old. They may either not have health insurance or, like Tiffany mentioned earlier, be enrolled in a high deductible plan, or they may only have hospitalization coverage only. So there's different factors there. And then also there's some income guidelines. But if you have any questions about that, we can help have those answered for any specific patients you may have a question about, or if you have a certain population, we can help you sort through that. But I think that's crucial for people to understand that it is a certain population. We're trying to help the underinsured and uninsured patients here. So there's another one somebody mentioned about or their local outreach efforts. Maxine, I know you all mentioned, and Tiffany mentioned some things about having things done in churches and social media, etc. Do you have any kind of thoughts on what you all currently do for local outreach?
We have an outreach department,
Okay.
and they take care of that.
Okay.
Mm-hmm.
And referencing one of the interviews, this is the McLeod-Timmonsville practice that had many examples of outreach. So when I spoke of using the Facebook page, the BCN coordinator there literally uses her own Facebook page, not the practices. And her job has approved that she attends health fairs in the community with information, but really meeting patients where they are. There's information that is made available in the lobby. A lot of information is shared by word of mouth. So local newspapers, billboards help. Now they don't use billboards, but in terms of asking pastors to reference it in Sunday sermons, that is something that practice manager did.
All right, and let's see. Then Miss Pamela Boyd, she has her hand raised. Pamela, are you there?
Yes, I am. I was wanting to know, hello everyone, I was wanting to know who was the regional service coordinator for the Winsboro area.
And let me see. Let's see if Stephanie is. Hi, Stephanie, are you there? And if not, Pamela, we can help find that out for you and get you in contact with somebody.
All right, thank you so much.
Mm-hmm.
Any more questions?
I don't see any.
So
hold on one second.
Okay.
Hold on one second. Let's see. Miss Hinton, Stephanie, you there? I saw you had your hand raised.
I see her hand raised, Andrew.
It's all right.
So while Andrew is bringing Stephanie Hinton, who is the director of the cancer prevention.
She has her hand raised. Let's see if she had anything to add. I'm not sure.
So hopefully we can get an answer to the regional coordinator's question, but as a follow-up to this email, what you can expect from us is a survey in terms of how you liked the presentation today, definitely areas of improvement, tools that we may not have mentioned today. We also owe you an example of the DHEC screening and billing form for Best Chance Network that Ms. Maxine referenced. So we'll be sending out sample forms as a part of your follow-up package. But I wanted to alert you, this is the first in a series of trainings for our partnership with the Best Chance Network and Wise Woman program. So in March, we will be doing a similar training for implementing an effective rural Wise Woman program. So we will follow a similar format as today. We will recruit a successful rural wise woman practice to present, and then we'll get into the nitty-gritty of what needs to happen with your EHR to support your success in implementing these programs. And so I won't go through the April, May, and June trainings, but if you see something here that is not covered that would be helpful to you for those that are implementing the BCN program, please let us know via the evaluation. With that said, Andrew, were we able to get Stephanie on?
Yeah, just a second. They've messaged me. They're on the line, but for some reason we can't hear them. So let's see. I just tried to make them. Or Stephanie and Trinessa, can you hear? Or Stephanie, can you hear us? Let's see. I guess they can hear us. We can't hear them.
So Andrew is communicating with Stephanie and Trinessa. They are the administrators for the Best Chance Network program. Stephanie is the director over the entire division of cancer prevention and control. So we will also be sending out key contacts for those regional coordinators so you can connect with them. So here are the key contacts. If you need to be signed up as a Best Chance Network provider, Trinessa Jones is your point of contact. Her information is provided here. If you are a well-oiled engine for your BCN program and you want to add that Wise Woman program as a dynamic duo, your connection there is Lisa Pecori. Stephanie Hinton's information is there as well. My name is Tiffany Simpson-Crumpley. I am a quality improvement coach and trainer for the Center for Practice Transformation at the Office of Rural Health. And LaShonda Petaway Brown, some of you may know her. She is a veteran quality improvement coach and can work magic with your EHR. She's probably going to shoot me for saying that, but very well versed in what it takes to build out your EHR to produce good quality improvement measure reports. We have additional team members internally that can help out as well. We have some billing experts internally that will help you with that aspect as well. Andrew, were you able to get feedback from Stephanie?
I have not.
Okay, so watch your email within the next couple of hours. We will be delivering information that was missing from today's presentation. We will also send out an evaluation. We are only as good as the communities that give us feedback. So if there's something that was not addressed here, let us know that in your evaluation. Also, if you are a wonderful BCN practice or Wise Woman provider, we are looking for speakers to co-present with me. We have training scheduled through June, and we want to engage people that are doing the work every day. So again, I thank you for taking your lunchtime to spend with me. This concludes our presentation, and I look forward to seeing you next month. Take care. Yes, ma'am.
If anyone would like to call and talk with me, personally, I'll be more than happy to talk with them.
Is it okay to broadcast your email? You want to give your email to everyone?
Oh, that's fine.
Okay, please share with the group.
It's mwright@ruralhf.org.
And most certainly thank you to Ms. Maxine Wright for sharing her experience as a BCN coordinator. I thank you for being my co-pilot today. And behind the scenes is Andrew Chandler. He's been manning the boards. Thank you so much for helping us have a smooth presentation, and I will see everyone next month.
Tiffany,
take care.
Just a few things,
yes, sir.
Just a few things before everybody signs off. So for the regional service thing, I've heard back on that, and I will get that information out. Let's see. And I think, the BCN is a grant-funded program, so I think Ms. Maxine had mentioned the 30 days of service for submission guidelines. They do have to adhere to that since it is through the CDC. So the 30-day thing, but I'm sure we can help get some workflows and everything established to help with that with others. So
thanks, Andrew. and we'll see you next month.
All right.
Take care.
Okay, bye.